I also wanted the formal education in particular so I could have a level of credibility and have a higher chance of landing more competitive jobs in the field. I knew at least that MPH, since it was considered gold standard, it would give me that foundation. And I had talked to some other public health professionals, professors, and classmates that were maybe a little further in that coursework or that career track. And they informed me that just an MPH, while you could go farther, the MPH would take me really far in the field and open doors.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 49. Hi everyone, Omari Richards here. Thank you all so much for joining me once again today for this week. Make sure that you all are subscribed, leave a like, leave a review, share with a friend. Appreciate you all. Hope you all are taking value from these public health stories. I'm just happy to be bringing them to you all. And so without further ado, here's today's episode. Enjoy. Today, we have an eager and motivated public health professional with 7+ years of experience in project management, program and policy implementation, analysis, quality reporting, and improvement. They got their Bachelors of Arts in Spanish Language and Literature at Transylvania University, and they got their Master of Public Health at the George Washington University Milken Institute School of Public Health. They are a member of the American Public Health Association LGBTQ Health Caucus Policy Committee, and they currently work as an epidemiologist at Lexington-Fayette County Health Department, LFCHD. We have Justin Bullock, MPH, CPH. Welcome to the show.
Thank you, Amari. Thank you so much for having me on the show. It's a pleasure to be here, and I'm excited.
Yeah, as am I. I'm glad that you made some time to be on the show, and I'm excited to tell and share your story. So how are you doing? How have you been coping during these times?
Well, so clearly the past year has been pretty unique and quite stressful, mainly due to the pandemic. Uh, so I made it a priority for this reason to get the COVID vaccine for one. So I could, and I got the Moderna vaccine back in February and January. So that took a lot of stress off just for obvious reasons. And I've tried to maintain my sanity by staying connected but managing my intake of what's happening in the news, the latest information that's being put out there in a variety of areas, but making sure I also balance that with some positive stories because it can really weigh on you, just hearing so many crises going on. So I try to always balance that with something positive. I guess some other things I'm doing, I wrote some of this down just so I wouldn't forget because I'm like, what do I do? I'm trying to yeah. So I definitely make it a priority to stay to prioritize my faith, relationship with God, and try and stay centered and strengthen that area. That's really important to me. I'm trying to cook more at home. Uh, I'm I'm sleeping more, so that I'm trying to get consistently 6 to 8 hours of sleep, and that's happening more now than it was probably in the middle of the pandemic. So, but I'm glad I'm kind of getting better about that because I can feel the effects of that for sure.
Yeah.
um, you don't really, I didn't realize how much that impacts you. I don't know. When you're in the middle of a crisis, you just keep going. and sometimes you're running on fumes. So now that I feel like things have settled down to some degree, I can definitely get a lot more rest. So I'm starting to actually do more physical activity. And right now I'm just going for regular walks and hiking with friends. Um, and I'm trying to be consistently intentional, even scheduling at times,
Mhm.
my self care and hanging out with my closest family and friends, because I can sometimes forget about that. I don't care about them any less. They know it, but things just get crazy. And I'm also being reflecting over the last year, and I've realized how much it is to be intentional and deliberate about how you spend your time. I don't want to do things that don't really bring a lot of meaning to my life. So I'm definitely being more active now and selective with the organizations, communities, and social and public health causes I support and work on.
Definitely, thank you for sharing that. I know that it could definitely feel like a lot. It feels like adrenaline is just pumping and we're just trying to keep going. And then
Yeah.
when the adrenaline goes away, you're like, oh, I'm burnt out. So I'm glad that you're making time for yourself and all those things. So tell me, you said that you used to not sleep as much as you do now, or during the pandemic your sleep was lessened during the middle and now it's better. What did you do to get more sleep, just in case someone else was suffering with something else similar to that?
Wow. Honestly, I don't know. So I guess I actually try to just disconnect from my phone. I have my phone scheduled to go into do not disturb like at 7 o'clock. Um, and so unless it's like really close friends or family, that phone call or the text does not alert me until I guess 4 or so in the morning, because I try to get up around 4 o'clock in the morning, but that doesn't always happen, because I think it's really important to try and get as much as you can done that's most important to you before the world starts to um, put demands on your time, your attention. And so before I get started with work and other things, I try to get like some prayer, honestly, some prayer, meditation. Um, what are my goals for the day? What am I want to accomplish today? Um, I try to kind of get a rundown on some news and kind of a different professional areas that I'm interested in, not just public health, but um, other areas. And sometimes I try and exercise in the morning, but sometimes that's in the evening. So I'm still trying to work down a good routine. I'm playing with it, but I'm definitely cutting myself off from several distractions earlier in the evening so I can kind of wind down. That was probably the biggest thing that helped me have more of a routine and get to bed earlier and give myself more time to fall asleep and just kind of relax.
Yeah, and I think that that's some key insights here. Just putting your phone on do not disturb, having a certain goal for when you want to get up, and doing these different things can definitely help you. So thank you for sharing that. I appreciate that.
Sorry, it was a winded answer, but
Don't worry, this episode is all about you, man. You do as many winded answers as you like. So it's all good.
I apologize to anyone that watches this. I hopefully they don't just cut it off. Like to
I hope
forever answer that.
I hope so too. I hope so, because there's gonna be some good information in this chat that we have here. So tell me, how do you identify, and then tell me a little bit about your personal background.
Yeah, so I identify as gender nonconforming. My pronouns are they, them, theirs, and I'm homosexual. Um So I was born and raised in Louisville, Kentucky. The summer of 2011, I moved to Lexington, Kentucky for undergrad. And for the majority of the past 10 years, I've lived in Lexington. Throughout my childhood, though, I saw often examples of suboptimal health throughout my parents' life and other family members and in the communities I was raised in. And so, since elementary school, I've always kind of wanted to be a leader in bringing about positive change, better health to vulnerable people. And I thought the best way to do that was to become a physician at first. And then, towards the end of my undergraduate studies, I realized that public health would actually allow me to bring positive change to populations um, over a longer period of time, rather than impacting members of vulnerable populations individually.
Yeah, well, thank you for sharing that. Could you explain to someone who mightn't know what gender non-conforming means?
Yeah, so gender is a societal construct that's related to sex, but a lot of people confuse gender and sex. Sex is actually scientific, it's based on your anatomy, your sexual organs. So I am male, but uh, I don't identify I wouldn't identify myself as a man necessarily, but I also don't identify as a woman, which is separate from sex. So it's how do you describe someone's sex in other terms? And typically that's man and woman, but it's not that I don't identify with either of those in a clear cut way. I'm kind of in between. And this is actually to be completely honest, you probably noticed my pronouns were he, him, his. For a lot of people get caught up on like, okay, I don't want to be that person. That I think it's important for, in general, for people to respect um, and just consider what someone who I just identify is non-binary and prefer you to use pronouns that you typically wouldn't use for them, and it's difficult. It's different. Most people aren't used to um, saying to one person they. That's, I mean, honestly, for me, when I was learning the appropriate terminology and for someone who's gender non-binary or um, who's trans, and they say these are the pronouns I would like to be described by, I thought it was not grammatically correct. But it's just something different. It should definitely be respected. So I don't want, on one hand, I don't want people to feel like they have to dance around it, but it is nice to, and I appreciate you for at least trying to understand that and make an effort to be respectful and just considerate. But again, long-winded answer, but
Keep them coming, keep them coming. But thank you. I really appreciate that, and I feel like just in the society that we grew up in, these things aren't spoken about enough for people to feel normal about them. And I think it's so important for people to identify as themselves, and you respect their decision to identify as themselves, because if you don't treat someone how they want to be treated, or they aren't viewed like how they want to be viewed, I feel like that leads to so many different psychosocial issues that are just not necessary.
yeah.
When we are all humans and we deserve to have that respect as a human, so.
Yes, I agree with that. And just to add on one little piece,
Mhm.
I was starting to say that this is new territory for me in a sense that I feel like these were things that are pretty buried for me, and I didn't really know how to describe. I didn't have the same awareness of myself until recently. I started questioning um, in a more intentional way. What are How do I identify, and what it like, do I identify as a man, or things of that nature. And over the last year has been when I really started to ask myself those questions. And I was reading an article recently in a American Journal of Public Health that actually explored members of the LGBTQ community, but also just people in general are being more reflective and trying to understand themselves better and their place in the world. And I was actually surprised because after I read that was when I started to question. I was, I don't know, it was just kind of weird, but how I started thinking about my own identity. And I think people being at home a lot in quarantine and isolation during the pandemic, we had most people have been a little bit more thoughtful, and they're coming to conclusions that they didn't give themselves time beforehand to really understand themselves, and why is it that we do everything that we do, and wanting to really take advantage of the time we have on earth, because it's all a blessing. So I fall into that category for sure.
Okay. Yeah, I appreciate you sharing that. I appreciate you being vulnerable and just being transparent with your thoughts and how you're going about going through that process. And I think it's just difficult for people to want to identify with something that they've never had an example around, or they just don't know, it's not pushed in like cultural media and things like that. So I'm glad that you are on the journey to discovering yourself and finding happiness in that. And I think that is so important for so many other people. And I hope that maybe there's someone who is gender non-conforming listening to this podcast that is able to take something from how you're sharing it and just your transparency there. So I
Thank you.
appreciate that. Yeah, no, thank you. So tell me, what does public health mean to you?
So to me, public health is, and I'm probably going to have an epidemiologist perspective of this, but I think it's the collection, analysis, and dissemination and guidance of health information and policy to surveil and improve all community and population health equally and equitably. Yeah, I would. Yeah,
Yeah, and I like your epidemiology perspective. I appreciate that because usually I feel like a lot of people are just more like generic on the sides of like what does public health mean to you, and I think this is great that you come into it with a specific like concentration lens or just field of public health lens. So thank you for sharing that. So you got your Bachelors of Arts of Spanish Language and Literature at Transylvania University. And then I heard you also say that you were thinking about doing medicine. And then now you're in public health. So tell me, what was the thought process going into undergrad?
yeah. So going into undergrad, I had it mapped out. I was going to double major in Spanish and biology. I was going to be on the pre-med track, and I was going to be a doctor. And that's just what was going to happen. Didn't happen that way because I would say I would say somewhere the end of my towards the end of my sophomore year, I realized that I had more fun studying Spanish, and I was interested in biology. It took more discipline to do the biology for me. Um, but it wasn't necessarily it wasn't that it was difficult. I just wasn't as passionate about it. And I um, was more interested in learning about cultures and languages and different perspectives about just approaching the way we live life. Seems pretty cliche, but that really was that was the way I was thinking at the time. And I also received a scholarship for music performance. And because most of my life, I've been involved in the arts, music, the instrumental art. And I played the saxophone and had several commitments to fulfill um, the scholarship requirements. I had to be a part of organizations, had to do certain assignments, it was the whole 9 yards. So double majoring, doing the music part, and later on I threw in studying abroad. It just was a lot, and I also worked 2 jobs while I was in undergrad. So both of them were part time, but there was still 2 part-time jobs throughout undergrad. So I ended up dropping the biology major, knowing that I could still pursue medicine as long as I took like the required medical pre medical school course load. And I completed all of that coursework through the middle of my junior year. And then I took a global health course. It was kind of general. I absolutely love that course. And that is when I decided and I realized, okay, I can get more bang for my buck if I go into public health rather than medicine. And kind of as I've already said, I could impact a lot more people. I could say develop some intervention and impact an entire population or community of people rather than just treating symptoms of a patient. And that seemed more rewarding for me to me. And so I immediately reevaluated my track, changed it, and I finished a Spanish degree, and I was going to at least minor in biology. And at that point, I realized, okay, well, I want to study abroad, and I still wanted to have a public health science aspect of the studying abroad, but I didn't want that to be the only focus. But in order to study abroad at any rate, I had to uh, drop the biology minor. And so at the end of the day, I was like, you know what? I don't even want to pursue medicine anymore. My undergraduate institution did not offer a public health degree, unfortunately. So at that point, I realized, okay, well, I'm going to have to go to graduate school anyway for public health. Uh, and so it doesn't matter what I do at this point. Yeah.
Okay, so was your introduction to public health that global health class that you said you
Yeah,
took?
that was my first time encountering public health. I heard about public health before I took that global health course, but I mean, I had taken some environmental health courses, but really understanding what public health was, that didn't come to me until I took that global health course. Uh, and to be quite honest, I think most of my classmates and didn't really know what it meant either. And I didn't. There weren't any. Obviously, there wasn't a program at my school, and I didn't maybe engage. I didn't know that this was something I should even start asking about. I didn't realize that until my junior year. So yeah, that
Yeah.
was the time. That was the moment for me.
Yeah, and and like I'm jealous of you getting introduced to public health in undergrad because I had no clue. I was like set on medicine until I got into my MPH program, and if I just like saw that public health was a thing and that
Yeah.
the healthcare system was just so messed up, I'd have been on that public health track a lot earlier. But I'm glad that you were able to get that experience. You said that you had two part-time jobs as well as doing your undergrad. So how did you balance that? If you did at all?
Yeah, I don't think I really had a balance. I don't know. I did a lot better than I maybe in some ways than I am now. Because I was exercising like early in the morning. I was still hanging out with friends. I was really regimented in undergrad, and I was doing a lot of extracurriculars. I was involved in student government. I was involved in my Black Student Alliance in undergrad. I was involved in the Diversity and Inclusion Club. I was on some steering committees, and there was some other stuff that I did. I don't remember. Well, and then I was involved in two music groups. We did concerts, and I was doing all these pre-med courses, and I was doing this Spanish major. I don't really know. I don't know what you would call balance at that point. I just was like, I'm going to soak all of these opportunities up, and I just really loved being able to sample a bunch of different areas and still have some sort of a focus, but kind of just explore what it was that I really felt passionate and strongly about. And I think kind of doing all those different things helped me to kind of say no to some things later. I mean, it really identified what I was more interested in, and what I was more willing to sacrifice some sleep or whatever, to kind of focus on the things that were more important to me.
Yeah, and that's a great perspective to take it in. I feel like as you're saying, like you figured out what you like, what you didn't like from doing all those experiences, but you immersed yourself in as much as you could early on in your career, which is it's well, your undergrad career, which is tough, but it definitely paid dividends in the sense that you were able to get a better idea of like what things you like, what things you didn't like, and how you could go about going forward from there. Are you currently still fluent in Spanish by chance?
Yes, I try and practice with. Are you? Wait, do you speak Spanish? Okay.
I cannot test you.
You know, every time someone asks that, they're like, okay, and then they'll say something really fast, and usually I understand what they're saying, and I'm like, that you just said something just to see if I could understand it. Didn't really make sense, but okay. But good, you can't test me. So, but yeah, I actually have used Spanish in every job I've had since undergrad. I used it at the hospital, in the ER, fairly often. And I definitely use it often in my current role. And in fact, tomorrow I re- I'm on rotation to help with a local vaccination clinic, that's hosted by our local health department, and I'm one of the kind of foreign language Spanish interpreters there. So that's one of the reasons why I'm working it tomorrow. And then I've used it quite a bit over the last year, in case and contact investigations. So it's actually turned out to be really helpful. Yeah, and it yeah, it's turned out to be really helpful. And I do try to so after I don't take that responsibility lightly, because I'm always trying to make sure I'm like keeping up on the skill, because it's hard. It's really hard. But I try to make sure I routinely, and I do, uh, keep in contact with some of my native speaking friends that live in different Spanish speaking countries in the world. Most of them are in South America and Central America. And I think I have one in Mexico, but I try to keep in contact with them at least once a week. Well, I meet with some of them like a couple times a week, usually at least 2 or 3 times a week, to keep that conversational Spanish up. And then I read some of the news I read is in Spanish. I read some literature in Spanish, and I try and keep myself up on the grammatical rules and things of that nature, just so I'm having integrity with that skill and providing that service, or in the settings like the vaccination clinic. I don't want to just, of course there are tests and such like that out there, but yeah, I'll stop rambling.
Yeah, and I think that's important, because I feel like a lot of people, even if they do Spanish, they don't practice it or they don't use it. So it's good that you're keeping in contact with native speakers as well as using it in your role currently and in the roles that you were in before. I definitely think that's a huge advantage for a lot of people. And Spanish is something that I would like to learn in the next year or two, because I just feel like it's a growing need to know Spanish, and it's just nothing wrong with learning it. I think it's just so
Yeah,
beneficial to so many parts of life in general.
I agree.
Yeah. So during your undergrad, you had an internship with the Environmental Health, Sustainability, and Human Rights intern at Parque Ac in Yucatan, Mexico. Hopefully, I didn't say anything there incorrectly. But how did you get this internship, and then what did you do in it?
So I got it through a Keys study abroad program that is offered in my state. And my school kind of connected me with that. So I knew I really wanted to study abroad from day one, from my first semester, freshman year. So I kept talking with them to make sure it would financially line up and such. And I kind of aligned that as best as I could with the study abroad office at my school. And the Keys program kind of aligns you up with, like a lot of study abroad programs, with the interest, study interest, and studying abroad interest that you have. And I made sure I told them I want to have some sort of health experience, internship, fellowship, what have you, while I was studying abroad. And I took some coursework as well while I was there in Spanish and some biology courses. So they placed me there. I chose the location, which was Merida, Mexico, and I'll say it was Merida, Mexico, just so yeah, so the Spanish speakers out there don't judge me. And so and just outside of the city was where this park, which is an NGO, non-governmental organization, and their focus was environmental health, sustainability, and human rights. And so I was actually super surprised, kind of the breadth of work that they did. But I just I sort of fell into it, having a little bit of focus and making that known to the program. So did I answer? So you said, how did I get it?
Yeah.
So that was how I got it.
Yeah. No. What do you do in it?
Okay, what did I do? um, so I was there. I helped guide. So the park was focused on sustainability practices and environmental health practices, and at least at that location. And the human rights components was external, external from the location, but on site I helped with giving tours to the local community of the park. And at the park, they had different um, kind of nature zones, I guess you could call it, where they had certain trees and plant life that was endemic to the area. And they kind of talked about different practices that preserve that life. And also they had different stations where you could learn how to cook and things of that nature more sustainably in a more healthy way. And then they had some environmentally friendly, like exhibits, like they had some solar panel exhibits. And they talked about other, even some practices that the Maya population there engaged to um, generate energy and power, um, and that was more protective of the environment. Then they also and they taught some courses as well, and kind of expanding, covering all those areas, and that those were typically to like school groups, but also tourist populations. And I kind of assisted with all of that. And it was kind of, I just kind of did a little bit of everything. And there was also a project that they had me work on that was preserving literature of local Maya populations, which was some of the human rights aspect of it. And I was involved in transcribing and um, translating some of that from like Maya, um, and to and well, I didn't translate it necessarily. I transcribed it from like the books that they had and made it electronic, and helped them kind of develop a database that would keep that information and literature preserved. So it's kind of, there's a lot of different things that at first I thought, how does this relate to what I want to do? But it kind of just opened my eyes of the different opportunities in public health and how different disciplines intersect with public health, that helped me not be so narrow-minded.
Oh, firstly, I'm glad that you were able to do a travel abroad experience, and it sounds like you were able to do a wide breadth of work. And I feel like we need some more organizations like this in the US to do this kind of work with our school children to really understand the importance of this and really sustainability and all these different facets of life. And I think one other thing that I think I picked up from there is like cultural belonging and how important that is to health. I think we let that breeze past a lot of the time. But like if you look at the Alaskan populations that are losing their languages and things like that, a lot of the younger people are just disconnected from their culture and they lead a lot unhealthier lives because of that. So there's a lot of a lot that you said there that people can take away from that, and that's great that you were able to get that experience.
Yeah, and I just thank you for identifying that. And I also want to say that I learned that of the different types of non-government organizations that exist and the value that they have, and being collaborative with and establishing collaborative relationships with the local communities, um, and between and having those strong relationships between local communities and partner external organizations is paramount to really having an impact, the impact that you or any kind of impact goal that you say you're going to have in whatever health initiative that you establish. You have to have that partnership with the local community. And I think that really was made clear in that experience for me.
Yeah, absolutely. And that's absolutely important for like sustainability, for sure. Having the buy-in of the local community. Were there any other takeaways that you wanted to share about your undergrad?
So I definitely will say have a plan for your education. It's specifically what your major is going to be, but be flexible in your course and major plan. Take advantage of as many opportunities as possible, and and manageable outside the classroom. Uh, yeah.
Okay. Yeah, thank you. That's some good advice there. I think like everyone should dabble into different things to see what fits them. So you graduated, and then you became a patient access coordinator at Baptist Health System. I have KY and IN here. I'm guessing that's Kentucky and Indiana.
Yes.
Okay. So how do you come across this role? How do you get it?
So I didn't know exactly what I wanted to do with my Spanish degree. And I explored avenues like medical interpreting, but when I did that, um, they seemed a little bit unpredictable, and I had to financially support myself. So, and you really your the hours you got, and I was going to get in medical interpreting and any kind of role, they wouldn't kind of be guaranteed until I had some experience in the field. So I did at least get some medical interpreting training, but I didn't know enough about public health at the time to know that I could ever work in public health without a degree in the field. So I was like, I don't want to. Medical interpreting doesn't seem secure, a secure option for me, and I don't think I could work in public health. So I worked with my career and development office during my senior year, in particular, and they connected me with the staffing agency. They had a relationship with the staffing agency, placed me at a Baptist Health doctor's office that wasn't the hospital necessarily. And after I worked in the position, which was temp, for about 45 days or so, I applied for a similar position in the ER with the main hospital, and I got it. So it was a little weird of a track, but nothing special.
Yeah, that's awesome. But it's good that you found out that you didn't want to do that job because you said like you don't have the experience, it's not sustainable for your life and everything that you wanted to do at the point in time, and you're
Yeah.
able to find a role that more aligned with that.
Yeah.
So what did you do in this role? Was it just like translation services, or what do you do?
Yeah. So overall, in a general sense, I worked with health insurance and medical billing, and well, I initiated that process, and kind of some health education, but more specifically, there was an aspect of general infectious disease screenings and record and infectious disease results that I had to manage in our EHR for disease surveillance. I thought it was a little, I didn't necessarily have any formal training at that point, but because of the position I worked in, we were one of the first um, departments to see patients before even the physician would see the patient in the ER. So they had us kind of ask some screening questions to patients about different infectious diseases, and then place certain precautions on their records. So that's one thing that I did. And then we had to give some infection control assistance to well, that we had that informed the nurses how to which PPE and things of that sorts to to utilize. So I also did some HIV/AIDS and other STI health education. We had to give some education materials and explain those to, in a general sense, to patients every time they came in, for health promotion, disease prevention, of course. And then, of course, like with the insurance, I did the routine processing, scanning, reporting, hospital, patient related documentation, that kind of stuff, um, and and promoting advanced directives and informing patients about that. I also did a lot of training, um, in the training new hires in that particular role, in the ER, on those registration, insurance, and disease surveillance workflow and processes, and how to use the electronic health records as well. So it wasn't a role that I was like, it wasn't an area of health that I was necessarily interested in. But I felt I learned a lot about professionalism and health services delivery in the US in this particular role.
Yeah, and those are important things that it's kind of hard to learn. Professionalism is not a lot of things a lot of people get training on or understanding how to just be in the workplace and things like that. And then healthcare systems, hospitals are just complex systems. So learning everything that's going on there could definitely be helpful just from like public health perspective, healthcare management perspective, or whatever you have you. So
Agreed.
During this role, you started your Master's of Public Health at the George Washington University Milken Institute School of Public Health, if I'm correct.
Yes.
Correct.
Okay.
So tell me, you said that you did some career planning in your senior year. Was going to get your MPH part of that career planning, or how did that go? Yeah.
So I knew that the MPH was like a gold standard in public health. I didn't have any formal education in public health, so I felt like, well, first of all, I wanted to learn more about uh, public health after taking that global health course in undergrad. And I was like, well, I need to learn more about this field that focuses on impacting populations and prevention. I also wanted the formal education in particular so I could have a level of credibility, and have a higher chance of landing more competitive jobs in the field. I knew at least that MPH, since it was considered a gold standard, it would give me that foundation. And I had talked to some other public health professionals, professors, and classmates that were maybe a little further in that coursework or that career track. And they informed me that just an MPH, while you can go farther, the MPH would take me really far in the field and open doors. So I pursued the MPH program at GW in particular, because that program I thought would allow me to continue working once I learned more about how that program worked. And at the time, the school was ranked number 14 in the nation, and now it's number 12. So I knew I wanted to attend a fairly high ranked program that was going to give me a solid foundation in the field.
Yeah, that's awesome. Yeah, and I know. I want to say George Washington University is because when I applied for my MPH, I applied to UF and then George Washington. Got into both, and I decided to choose UF just because my brother was there, so I was like, I'm gonna chill with my family for a bit. But it was very close because I feel like the connections that university had with different organizations to allow you to like different internships and things. I liked how they I guess expressed that to me. It was very positive. So did you have a specific concentration going into this?
it sort of changed a few times, but I ended up concentrating epidemiology and public health research methods, which wasn't too much of a surprise for me, but I liked that program in particular because I felt like it made it easier to narrow down while I was in the program what it was I wanted to study or concentrate on. And so I always went back and forth with epidemiology and health policy, but I really loved the data and data analysis and the stats. So I thought, well, let me first explore epidemiology, and I've not regretted it.
Well, I'm glad to hear that. I'm glad to hear that. So during your time in your Masters of Public Health program, you were an intern at the Environmental Health and Emergency Preparedness at Lexington-Fayette County Health Department. So how do you come across this, and then what do you do in this?
I was looking for an opportunity to fulfill my MPH practicum requirement and gain some experience specifically in public health. I specifically wanted to work in epidemiology, and I ended up getting to work with a variety of public health specialties, not only epidemiology, but also environmental health. In this internship, public health preparedness, and to some degree, health policy. So I think that experience was crucial as it allowed me to directly apply what I was learning in the classroom while I was still in the MPH program. I did learn from that. I was more interested in epidemiology and health policy and not as interested in environmental health. Uh, yeah. Uh, so finding that out did help me better prioritize the coursework I engaged later on in my MPH program and in job searches. But trying to think, how did I get? Honestly, I reached back to my career development office at my undergraduate institution. I had already during my junior year, around the time that towards the middle or end of that global health course my junior year, I was looking for public health internship opportunities at that point. And I didn't dig as deep as I wish I had, but I did look locally to my health department, the one I'm at now, and I didn't land it because they were prioritizing MPH and DRPH or PhD um, students at the time. So I kind of knew what kind of process I needed to go to and what contacts I needed to reach out to at the health department, and who people at my undergraduate institution knew at the kind of had a relationship with at the health department. So I just once I became an MPH student, I just leveraged that, and it didn't take that long for me to get it at that point. Once they knew I was an MPH student.
Yeah, and that is key information right there. You said that you started searching in your junior year of undergraduate for opportunities, and you realized from that the opportunities that you wanted, people wanted MPHs, Dr. PHs, or PhDs, and you realize, okay, this is something that I have to put onto my path if I want to get into this role. And I think people take too long to realize those kinds of things. They want to do it in the last 2 weeks of the semester before they graduate and start looking for jobs and things like that. So do what Justin did, like be proactive and really find what you like, what you don't like, what you need to do to get to those roles that you want to get to. Because I think it's just so key, especially in the world that we live in now. It's a lot easier to gather information.
It is. I mean, there's so much on the internet. I think there are more than we think. People are willing to help you if they see that you are willing to take some initiative and put in hard work. Um, and you have to be vulnerable and put yourself out there. It's not easy. I struggle with that to this day for sure. But it's when I've done it and I've been consistent about it, it's paid off for me. I also want to say about that internship experience, it taught me that formal education is nice, but you can't replace field experience. So it's important to get any kind of real world experience, whether that's in an internship space or that's you're doing research, whatever avenue you take, that real world experience is invaluable. And you can also, from that experience, quickly determine um, the track or specialty that you want to really pursue, um, given whatever goals you have or whatever your priorities are. Any opportunity to get that field exposure should be taken advantage of.
Yeah, absolutely. And especially when you're younger, when you're less developed in your career, take on those volunteer opportunities and things like that to get those experiences, to learn about it, to learn what you don't like, what you do like, and everything like that.
And I'm glad you said when you're younger, because there are there are quite a few. There are definitely more paid internships and fellowships out there than we think. I learn more and more every day, and about those paid internships. Now, the one I did was not paid. I did, however, pursue some paid internships, but there are some that are paid. So even if you're doing a late career change and you're like, I have to have money, you've got a family. I mean, whatever that may be, that responsibility that you're thinking of, that you cannot sacrifice or compromise to get that experience. There are those paid internships out there.
Yeah, absolutely. You just have to look for them and start looking early because everyone else is looking for them too. So
Absolutely.
definitely. Were there any other takeaways during your MPH that you wanted to share?
Wow. So don't be afraid to ask for help. Um, I there was such a big difference in the professional standard and expectation and responsibility of a graduate student in general, that was so different from my undergraduate experience, that I just felt like I couldn't fail, or I wanted to measure up. And anytime I didn't get something right away, not that the program was super difficult, it was just there was just some practice. There was a lot of discipline that I had to have, especially working full time while being in the program. There's some things that if I had just maybe asked for help a little bit earlier, said I don't get this, talk to some other classmates, my professors, I would have saved myself some headache. And when I started to do that about midway into my MPH program, when I started to do that more, the experience became more rewarding, and it was a little bit more easy to navigate because I was asking for help. I thought, well, I don't want to be seen as dumb, uneducated. A lot of, I would say, over 30% of the students that I was in classes with, they had some advanced degree. They had already had way more career experience than I had. I mean, some were MDs, some were nurse practitioners, some had already had an entire career. And I just thought, wow, I've just got to bring it. And I can't show any vulnerability. But there's a lot you can learn from them too if you're just open and honest about any kind of gaps or areas that you may need some advice on. So ask for help, utilize your resources. My MPH advisor was amazing. She made the experience in helping me learn what my requirements for my practicum were, and to fulfill those. And there were some things that I needed to maybe have some exception, or I did. There were just I think some of the requirements, like for my preceptor, he had like 40 years of experience in the field, but he did not have a public health degree, a specific public health degree. And I think that was one of the requirements for my preceptor to have, so I could count that practicum experience. But she helped me navigate. I realized that wasn't a requirement that they were being strict on, and the experience fulfilled that requirement, and I could get around that. But I only was able to figure that out because I asked about it. I was open and honest about it, and I utilized my resources.
Yeah, yeah, absolutely. I think asking for help is key. We, I feel like we need to ask for help more times, because oftentimes, especially like if you're asking just questions in general, a lot of people have the same questions as us. But help in general, like when you're able to open up yourself and ask for that help, then you know that person is going to be more able to help you. They know what's going on in your life. Like one thing that I always took away from my MPH program was talk to your professors. Like if you're feeling stressed out and you need to like push things back or something like that,
Yes.
they are humans. But go to them earlier on and let them know that, okay, these different things are going on, and work with them, and they'll work with you. So definitely,
Absolutely.
yeah. So ask for
I've
help.
definitely had that happen, and there there were a few times, honestly, a few times where I may have turned something in late because I thought I could crunch everything in, and I had put myself under this time crunch because of some life things happening, some stressors, and I paid a consequence for it. I got a lower grade, and then I started being more open and asking for like extensions if I needed to do that. And I didn't have to do it all the time, but when I did ask for it, they knew the kind of student I was. And they were receptive to this extraneous event happening, and I often was able to turn it in with some extra time given and without any penalty, as long as I was proactive about before the deadline, telling them, "Hey, I don't think I'm going to be able to meet this deadline." So I totally agree with what you said.
Yeah, no.
Professors are human, and they understand you. Most of them are here to make sure we succeed.
Yeah, absolutely, absolutely, and yeah, definitely just take your time if you need help. But one thing that you just said was that they knew that you were a good student, so you have to also show them that you're putting in that work before, and you're not just slacking and you just need
Yeah.
this time because you haven't been doing anything, but it's actually a life experience that came up. Okay.
Yes.
So you got a certificate in public health management from Unite for Sight in last year. Yeah, last year.
Yes.
So what made you want to get this, and then what do you learn from it?
So I definitely wanted to expand the knowledge I gained in, I think it was a health policy and management course that I took early on in my MPH program. I also wanted to build upon the experience and insights I had gained in my internship and prior work experience. I wanted to stand out among other job applicants and coworkers by demonstrating the additional effort I was willing to put in to becoming a competent leader in public health, despite being a young professional. That was my thinking when I pursued it. And I did some research and determining, try and figure out what were some management certificates or any kind of training that I could do that wasn't going to be overly expensive, like so expensive, absolutely not require me to get another degree. And it wasn't going to take, a year to do. because I was just trying to give myself an edge in the application process. I was trying to I started applying before I was finished with my MPH program, and I was getting interviews. And when it was all said and done, I had applied to shy of 130 applications, like different jobs, and I had over like 20 interviews. It was about 20 interviews, I think. I was doing that from before I finished my PhD program up until I got this epidemiologist job. Mm-hmm. So it took a while. It took under a year, just under a year or so. I think 6 to 8 months or something like that. I'm not. It's late in the evening, so I'm not probably doing the math right. But towards the end there, I was like, I've got to keep doing stuff to improve myself, even while I'm in the middle of this process. So that was one of the reasons why I sought that certificate. I learned, one, there's a lot that I read that I would have to practice in order to really become comfortable in and using different leadership strategies. But I also learned there were things that I had already exercised without being able to put a name to it, that I had exercised in my undergraduate leadership positions. I was president of some organizations, including my Black Student Alliance. I had some other leadership experiences. And so it improved my confidence, and what I already knew, showed me other things I didn't know already. And just having that gave me more confidence in what I was bringing to the table, and that it kind of highlighted that skill set for other employers too, and was my thinking.
Yeah, absolutely. And definitely March 2020 is a time, and is a crazy time to think about. And
yes.
I know the world is never going to be the same.
Exactly.
Public health is never going to be the same either.
Yes.
And I think, like, as that hit and as everything came out, public health became a lot more competitive during that time, as people were losing jobs and things like that. So
yes. And that was definitely I don't mean to cut you off. You can go ahead.
This is your show, man. Come on.
Well, so I wanted to touch on that because it's like the elephant in the room. So I definitely, that month, I was noticing, like, I was keeping up with the news, and I had heard about the outbreak at that time in Wuhan, China, and there was a lot of stress and worry about what was going to become of it. But there's a lot of skepticism about whether it was going to even reach the US, and all kinds of doubt and what have you. And I don't, that whole situation developing, and as I saw it spreading, I kind of was thinking ahead and trying to position, especially once it got to the US and it was spreading. At that point, I was like, this is a once in a lifetime period in my life that I don't want to miss whatever is going to develop. Now, obviously, there's a lot of negative. The pandemic has brought a lot of death, sickness. I mean, I don't need to state all of those things. It's obvious, and so many people have experienced that in their own lives and their families, etc. But I wanted to capitalize on the need for public health professionals growing at that time, and it just happened to be. I don't want to say I knew what was going to happen, but I just wanted to position myself to be ready, and it just worked out for me. I'm grateful it worked out for me.
Yeah, and having that foresight of just knowing that you have to prepare yourself and do more than what's expected to really get ahead was something that I commend you for. Definitely huge. And you also got a certificate in infectious disease and infection control. So did you want to get this for the same sort of reason that you got the other certificate? And then what did you learn from it?
Yeah, so it was some of the same thought process. The public health management I thought that was going to tie well into the health policy, and health policy was one of the field or specific areas that I was targeting in my job search. And then the other kind of specialty area I was targeting was epidemiology. And so I felt like the certificate in infectious disease infection control would potentially give me an edge and bridge that experience gap to some degree, and make me more competitive than I was before for an epidemiology role. I wanted to, I needed to increase my infectious disease knowledge because I didn't have, I mean, everyone graduating with an MPH has some, and I mean, I needed to stand out with that, I mean, from that pool. And then I wanted to, again, show my initiative to become more proficient in that area. And I did gain some experience in my internship, and of course the MPH program, but I needed to build off of that. So again, some of the same reasons. Yeah. And I don't know if those were the reasons for me landing my current job or not. I was just like, I'm going to do whatever it takes. Uh, that was with, that was something I thought I could definitely do. And they weren't expensive. To be honest, they were each $100. I did my research to make sure I was looking up credible organizations, companies that were offering those. And there's the infectious disease certificate was through University of Houston, and Unite for Sight was the organization that offered the public health management certification, and um, they seem to be credible.
Yeah, and I think
So,
it.
sorry.
No, you go ahead. You go ahead, please.
So I want to finally add, again, kind of what I learned from the infectious disease one, again, was you can't replace field experience because there is so much. Um, I realized that I didn't learn in my MPH program in detail that certificate opened my eyes to. It made me realize the breadth of knowledge I was going to have in epidemiology, or gave me an insight into that. It was still turned out to be bigger, but it kind of prepared me for, okay, this is what you're about to get into, and this is what you're going to be required to know if as an expert in this field. And it takes, I also learned it takes intentional effort to stay on top of your game in your field. There's the amount of information that I had to cover in that in that certificate in particular, well, in both. I had to study, I had to, and to really retain that and apply it, I have to revisit that information. And every other week, I go over some of that same material just to keep it fresh in my mind. And I have to use a lot of that now. In a world, one last thing, in the world we live in now, and the current times where public health or public trust in government is low, public health knowledge, experts in science are constantly being challenged. I it, it This certificate, and really both of them, helped me realize how important it is to be credible, and base everything you can in as many facts as possible, because you don't want, the last thing we need is another reason for the public to not trust public health professionals, and to lack confidence in whatever guidance we're giving.
Yeah, absolutely. It just takes a little bit of doubt, and that could go a huge way negatively. And I'd just like to say that getting these certificates, you said you weren't sure it helped you get your job. It definitely didn't hurt you in getting your job. So
yeah,
so the definitely is a benefit there. How did you go about researching for these different certificates?
Google.
Okay, that's what I thought.
I just Googled them, and I didn't ask any professors. I didn't. I did one thing that did inform, like, the wording of the certificate and what it covered, was I paid attention to what the requirements in certain jobs that I wanted, but maybe didn't necessarily qualify for because I didn't have a certificate of some kind. So the certificates that I looked at kind of touched on the ones that I saw were required. There were others, like the certificate in infection control, the CPHQ, the certificate in professional healthcare quality, or something like that.
I'll
It's
no
so
worries.
there are quite a few that I saw that were required for some of the jobs I wanted, and that did inform the ones I pursued.
Okay, and yeah, that makes sense. And I think going back to your point, you knew what you were looking for before you looked for the certificates. You looked at
Yeah.
the job postings and seeing where you needed to build skills. And I think people might just go for certificates without really thinking about how it's actually applying to what they want to do.
Mm-hmm.
So I'm glad that you mentioned that, because if someone is looking for a certificate right now, look to see what jobs you're trying to get first, and then
Yes.
complement that with the certificate that you need.
Absolutely. And even if it's not required by the job, there may be a skill set that you may not be as confident in that is required by the job, or maybe I didn't like my previous work experience didn't, there a lot of the buzzwords for the jobs I was looking for wasn't in. I had to kind of um, really think deeply about how what I had done before
Mm-hmm.
related to the jobs that I wanted to pursue. And there's only so many there are only so many connections that I could draw, because it wasn't directly in public health, it wasn't in that specific role. So I just tried to figure out where could some of these gaps be bridged, and make an employer more confident in what I'm bringing to the table that they're looking for.
Yeah, absolutely. That's great advice right there. So you're also a member of the LGBTQ Health Caucus Policy Committee at the American Public Health Association, or APHA. So how did you get into this role, this job, and then what do you do as a member?
That role is is a volunteer role.
Mm-hmm.
I received an inquiry from the Caucus leadership, asking if I was interested. And since I had indicated an interest in that particular caucus on my APHA member profile, I decided to reply and move forward with joining. And it was an easy initial process, and it's been a wonderful experience thus far. There, since I've joined, I would say there have been there are a lot of opportunities to collaborate and leadership opportunities that I've had. But again, it's voluntary, and I sought it out in January 2020 is when I joined, because I wanted to get involved in LGBTQ health advocacy and policy work specifically. And this seemed like an opportunity that was easily accessible, staring in front of me, since I was already an APHA member. I'm sure, like a lot of good MPH programs, you were told, like I was, join APHA and you get a scholarship. At least GW, they did that, and I got a scholarship for being an APHA member. So, I mean, it was just kind of there, and I wanted to take advantage of that. So, this is just one of several health caucuses APHA offers, which is slightly different from sections. So, when you become a member, you automatically get put into, you can select 2 sections, and that's included in your membership dues. But the health caucuses are a little bit different. But you do pay a separate comparable membership fee for the health caucus to join and financially support the caucus. But I believe you don't have to be a member to engage in the caucus's work. So if you just want to help out, you don't have to pay for that, but to be a member, you do. The caucus, it generally is engaged in policy work and policy review. So we set policy priorities that are specific to our caucus. And given the different interests of the caucus members, we may develop, well, not only the interests of the caucus members, but the kind of the mission and goal of the caucus. We kind of assess all of that and match any kind of policy topics of interest to the group with the goals and such. And we work together to develop those policy briefs, policy statements, and we submit those to APHA so they can utilize, APHA can utilize those policy statements and any kind of policy statement they may submit to the U.S. government in supporting or any kind of policy argument they may have, depending on a particular legislation. So since I've been involved with the caucus, I particularly have helped in data collection, development, analysis, and sort of quality improvement of the policy statements that in particular advance LGBTQ health equity for critical, important health policy topics and issues. And I also help monitor kind of committee quality improvement and performance. And I was one of the initial members of the quality improvement subcommittee that helped do that monitoring of the work the caucus does through development and tracking of compliance with the committee's mission, framework, objectives, and action plan, which we also helped to create. So it's been pretty interesting, that kind of work that we've done, but I've learned a lot since I've been involved.
Okay, yeah, that's awesome. I was familiar with the caucuses, wasn't really too sure what they did. So you definitely just helped me understand what they did.
Good.
And I definitely think that I should probably be a little more proactive and try to join one of these caucuses as a member. So thank you for sharing that with me and everyone else who's listening. Join the APHA caucus policy committees, and because it seems like a great place to get information, use the skills that you're knowing, as well as build relationships. So
yes.
That's awesome. And then you're also a member of the education committee of the NAACP. So what made you want to get this, and then what did you learn in this role?
So I wanted to get involved in, to be frank, I wanted to get involved in policy work that was going to improve the well-being, the health, well-being, and uh, of the Black community, and specifically, and people of color. And I thought this was a direct way to do that. There are, I also, and I guess there are public health, or I mean, I could have done it through APHA, but this was a way to get involved in policy work, helping people of color, but also getting involved locally, because I just wanted to get more involved in my local community. So uh, I really, I just did some research. I mean, I knew about the NAACP. Most people of color, most Black people know about the NAACP, longstanding or civil rights organization. So I did some research, and I realized that there is a local chapter here in Lexington, and I reached out to figure out how I could join. And I've I've been a part of the organization for over 6 months or so, and I'm loving it. So you also asked, what did I learn?
Yeah, what did you learn?
You can't tackle. I mean, there's so much work to get engaged in at any level, and I think public health, we learn about the big picture, and we focus on the big picture a lot. But sometimes it's easy to lose sight of what you can do locally. And issues are just as complex and pervasive and prevalent at the local level. And I'm someone who likes to just dive in and try and fix everything. And there's so much I'm learning in terms of protocol, the respecting who's been there and already engaged in the work. I'm so quick to, I want to get involved so quickly, but there's so much I don't know, and how to go about community organizing and advocacy and activism that I'm learning being a part of this organization in a different way than the advocacy I'm doing as part of the LGBTQ health caucus, if you will. And so it's a huge learning curve, but I've been impressed by the few there's a huge network, but the local chapter that I'm on or involved in, specifically the education committee, they're very focused in the priorities they are targeting, and they're doing excellent work, focusing on in part the learning disparities, and the gaps in learning resources for students of color. And there's so many. I think the pandemic happened so fast, and there's so many health disparities, but also education disparities highlighted because of the pandemic. And I just think everyone was trying to slap a band-aid on everything, and and not because they maybe necessarily didn't care, but because they were just trying to be reactionary and try and solve problems quickly. But that resulted in so many communities and particular communities of color, vulnerable communities, low-income communities, all types of communities, but they typically tend to be communities of color that suffer the most. That there's so many gaps that just were overlooked because of how fast paced things were, how fast things were developing during the pandemic. And so I'm really fortunate to be a part of this organization committee to try and highlight some of those areas to our local school board and try and get them addressed and resolved.
Okay, yeah, that's some important work, and I'm
Another
glad.
long-winded answer.
That's
Sorry.
absolutely fine. Nothing to say sorry about. Yeah, that's cool that you're getting, that you wanted to get involved in the local level, and I think it is telling of you to say, like, you wanted to get in there, and you see all these issues and you want to go running ahead doing your own thing, but then you don't know what you don't know, and you don't want to like step on the toes of anyone else that has or is doing that kind of work. So I think that's good self-awareness to know when to pull back and just say, okay, let me just relax and look and see what's going on and see how I can plug myself into what is already happening. So that is some great insights right there.
And I guess the last thing I'll add to that is I mean, there's so many things that we saw happening with our community, within the Black community and communities of color over the last year, over the last 4 years, that it just reached a level, an inflection point last year that I felt that I needed to do something of substance to like make a difference and get involved in that kind of work in a way that was different from what I had already done. And I've been involved in similar work, but it that work was more convenient for me, and it was right in my face in undergrad, and I didn't have to go so far to really engage in that kind of work. And I wasn't as connected as I wanted to be, and I just, with everything happening, I just felt like I needed to do something, and this was one of the ways I felt like I could contribute.
Yeah, and I appreciate that. And I think we need a lot more action, especially in the Black community. So that it's great work that you're doing, and I'm glad that you pushed yourself outside of like what was right there, outside of your comfort zone to really get into this role and build from there. So currently, you're an epidemiologist at Lexington-Fayette County Health Department. So I know you spoke a little bit about looking at these types of job roles and then working backwards and doing your certificate. So tell me about the job process of getting this job and what role did those certificates, if, well, I guess you don't really know, but, so yeah, how do you get this job?
Yeah. Um, how did I get the job? So I think number one, I think the internship experience played some role. Again, I don't know how, if at all, but I do think relationships matter and what people remember about you, your work ethic, all of that matters, your reputation. And I did consistent work. Um, I wouldn't necessarily say I was a superstar as an intern, but I showed up every day I was scheduled. I did the work that was asked for me. I was inquisitive. I asked a lot of questions. I tried to learn from everyone that I interacted with. I never said no to any opportunity while I was there. And I looked the part. I showed up every day ready to learn something. And 3 years, I did the internship for about 6 months, and I was done first quarter of 2018. And then 2 years later was when I applied for my current job. And it turns out when I interviewed, the head leadership for the department I worked for in my internship was like the lead interviewer for this job. And I had also done some work with with the epidemiology department, infectious disease department. And the one of the staff I worked with, she had um, gotten promoted to being essentially the supervisor for that department, and that was the department in which I would work as one of the EPIs. So she was also in that interview, and I worked with her directly during one of the I think it was a free flu clinic that I did when I was in my internship. So the third person in my interview, what I think we had crossed paths, but I didn't really know a lot about her. But she, of course, had heard my work and stuff like that. So all the people in my interview I had encountered them during my internship, and two of them directly. So I mean, they remember me, and actually, I was a little bit more comfortable in the interview because I started out greeting them like I knew them, and I did remember them. They remembered me. And so I think that you can't underestimate that relationship, or um, they remembered the face, and I'm whatever else. I A lot of the epis that I work with right now, some of them have over 20 years of experience. Some of them have 10. I'm the youngest in my infectious disease department, and they tease me about it sometimes, but um, I say that because it had it was me being in the right place at the right time, and like several things lining up. I believe that because there were two temporary epis that came after I got this position, and both of them had quite a bit more experience than I did. And so had I gone up against a couple of different people that had so much more experience than I did, and as an epidemiologist, I may not have gotten that position, but I was ready to walk through the door of opportunity when it presented itself. I believe that. So, okay, all of that is really to the internship. I was, you know, I had set certain boundaries, or I had set my sights on working in certain places. Like I was looking at jobs in other states and major cities, and like I had a pay range that I was looking for. I mean, come on, we all do that. Obviously, I'm extremely passionate about the work, but I had just tried to be intentional about the specific roles I wanted and what my needs were as well. Um, and I had to compromise on some of that. And so I asked a couple of friends, hey, should I apply for this job? And being in the middle of a pandemic, I saw this as prime experience that I couldn't pass up on. And so I just went for it, and it just worked out. Sorry, long-winded answer.
Oh, but that's good. That's good. And I think like they could have remembered you for the wrong things as well. So it just goes to show that you showed up and you did the right things for them to remember you for the right things for you to get the opportunity, or for them to give you the opportunity to say, okay, yes, we know this person and they do good work and they're gonna be a good fit to the team, even if they're the youngest, even if they don't have the most experience, they can always learn. So that's great. So what do you do in your role as this epidemiologist?
Uh, Okay, so the top, I guess some of the general categories would be I for any reportable disease investigation, I am expected to stay updated on and understand and be able to provide guidance to others regarding any kind of CDC and state level guidance, case definitions, and what are the proper protocols to respond to these reportable diseases and cases of those, to make sure they're properly followed up on, we're preventing the spread of those diseases, and that they're getting the treatment they need, they're following, wherever they go get the treatment, that those important infection control precautions are taken, any kind of important follow-up is conducted, and that all these data are collected and reported to the I guess the public health governing bodies, and that for me is typically the state health department and CDC. I also help take the lead on any kind of data project, on any kind of intervention that the health department proposes or is facilitating. So in particular, there is vaccination with these vaccination clinics. Our department, the epidemiologists, are required to collect vaccination data for our jurisdiction and report on that given certain deliverables or specific data points that leadership wants to know about. And of course, we share all this information with the community as well. And that's what we've been doing with COVID-19 data, aside from COVID vaccinations. So there's a lot of work that I do that's not related to the pandemic, but most of the work since I've been in the role has been pandemic focused. And so there's a lot that I didn't expect that I would have to do that I've done, in terms of like providing leadership to so many different teams that we have on the response, which I think is like over 11. Mm-hmm. And at one point we had about 150 or more staff on the COVID response. And I was one of the epidemiologists required to give them COVID-19 guidance based on CDC guidance, FDA, our state health department. I've had to, especially early on in the response, I had to create a lot of standard operating procedures for those different teams, giving specialty settings that they were required to monitor, whether that be businesses, long-term care facilities, shelters, correctional facilities, things like that. I've created a lot of training videos on the different kind of work we've had to conduct throughout the pandemic, including but not limited to data collection and reporting. So of course I have had to interview cases, contacts, and particularly one of the epidemiologists, I have to help kind of de-escalate situations, people not wanting to isolate, that kind of stuff. Mm-hmm. At times we have to flex our public health government muscles, and just to keep the community safe, of course. But that's complicated, and so we try and help navigate that for the staff that work with us. And like and then there's non-COVID stuff. Like more recently, I've had to help kind of investigate Ebola travelers, given the recent outbreak in the Congo and Guinea. So uh, that's just a bit of it, but I've been really grateful that all the experience I've been able to uh, get in this short period of time, because I don't think in a normal period, normal world, a normal year, I wouldn't have gotten all this different kinds of experience in management, leadership, the scale of a lot of the projects we've done. So it's been quite a roller coaster, but I've enjoyed every bit of it.
Yeah, and that's great. And I just wanted to say thank you for the work that you're doing. It's very important. You keep on being a public health hero out here. We appreciate you a lot.
Likewise, thank you.
Yeah, my pleasure, my pleasure. So before we move on to the last section of the show, where would you like to see yourself in the future?
Wow. So in a general sense, I would like to see myself on it. Okay, so I want to be someone that is pushing public health agenda and challenging public health discourse and programming policy, um, and with integrity, to really be to really improve the health of vulnerable populations. That's at the heart of anything I would do. My goal is to, at whatever scale, is um, to have integrity about the data and evidence that's being used to highlight public health gaps, particularly as they relate to vulnerable populations, and to make sure that is actually being considered when developing policy and implementing it and um, evaluating it. Uh, and to do that as much as possible in a creative way, innovative way that's going to be most helpful.
Yeah, thank you. Thank you. And I look forward to seeing how that unfolds and how you're able to impact those vulnerable populations and really make those changes and stand up for those populations in the line of policy, which is something that a lot of the time the vulnerable populations just kind of left out. So I appreciate you sharing that. And moving on to the last section of the show, the Furious five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Um, well, one, you're not going to get rich in public health. So make sure this is really what you want to do. And I don't say that to be negative, but to just be intentional about the work you're engaging. I think it's a real privilege to be able to impact populations and really address the underlying causes for um, the health challenges that they face. It A lot of the work that we do is not a quick fix. So understand, really get a good sense in all of your education experiences and in terms of any job or internship. Really try and understand what is public health, what are the different opportunities out there, because there's so many. But a lot of I think it took a while for me to truly understand what public health was, and a lot of my classmates didn't know what it was. So you can't really make a difference in a field where you don't understand. So try and get as much experience as you can and understanding of the field, and really know that that's what you really want to do.
Great. Number two, if you're talking to someone wanting to get into your position, what advice would you give them? Besides all the great advice you shared earlier. Or you can share that again too if you want.
No, I won't repeat myself. I try not to. So um, to get in my position, what advice would I share with them? Uh, it's kind of along the same lines, but really, you can't get involved early enough. You and I have seen so many public health professionals or just students that have gotten engaged in work either before they even started their education or really early on. And I'm inspired by that. So, and the world is at your fingertips if you do, the earlier you get involved. So that's, I mean, any kind of experience you can get in epidemiology, infectious disease is going to really be helpful. Read a lot uh, and find role models. Honestly, I that's something I haven't shared. So I have, I mean, years ago, before I even started my MPH program, I looked at different people, industry leaders, um, and I've looked at their career path and what they've done when they've done it and what they were able to accomplish. And that has inspired me to keep going and doing what I'm doing, but not that I'm anywhere close to where I want to be, but that gives me a goalpost, what's possible, and to keep challenging myself. So have find role models in the field, in the industry.
Great advice. Number 3, what's something you are working on improving in your life right now?
My health, making my health and self-care more of a priority, taking more calculated risks, and exercising my creativity and faith to accomplish many other professional self-development, even entrepreneurial goals that I have.
Okay, awesome. Number 4, professionally, do you recommend anything?
So, shameless plug, definitely recommend this podcast, Public Health Millennial Podcast. And then I have 2 books that I love. Um, and I've recently, one I'm still reading, and one I've recently finished. COVID-19, the pandemic that never should have happened, and How to Stop the Next One by Deborah McKenzie. I just think, I mean, everyone's sick of COVID-19. I'm sick of it. But I think while it's fresh on everyone's mind, um, it's important that we really reflect on the pandemic and how it's been handled and how to do better. And I think this helps ask some of those important questions to start that conversation and really take advantage of this being on everyone's mind. And I think one thing that a lot of public health professionals have talked about is just the funding and the public health lack of public health infrastructure and how that was exploited by the pandemic. And if we don't have if we don't tap into this pandemic being on everyone's mind now and really stress the importance of having those resources and the funding in public health to be more proactive in preventing the next pandemic, then we're going to see some of this. We're going to see the same thing happen, and we're going to see the same issues. Another book that I'm still reading and I'm loving is Cast. The Origins of Our Discontents by Isabel Wilkerson. And I think public health, I mean, racism is being, um, is being accepted more and declared by public health organizations as a public health issue. I think it's being more recognized as a public health issue. And I think that's extremely important in trying to just dismantle it. And, but a lot of people don't know how to talk about racism, and they don't have the vocabulary to discuss it, and they're very hesitant, and they just don't know how to talk about it. And it's extremely triggering and an emotional subject. But I believe this book starts the conversation using different vocabulary that I think will allow people to not be so triggered early on in conversations that are necessary to have if we're going to start to really dismantle systemic racism and all the other forms of racism.
Okay, definitely. Thanks for sharing those. I will add them to my ever-growing list of books to read. Last but not least, where can people connect with you?
So they can connect with me on Twitter. I don't know what it's called, handle.
Yeah.
Yeah. It's Justin L. Bullock. And that's my favorite platform, and I'm most active there, but I got to do better. So I will be more active soon. So they can also catch me on LinkedIn, Justin Bullock, MPH, CPH. I have recently been inactive, but I'll be posting new and fresh content with regularity soon. And I'm also on Instagram. My handle there is Bullock, my last name _JL. And that's a fairly new account, but I'll be more active there soon.
Okay, awesome. Well, I look forward to connecting there and just seeing where you go from there, and seeing like how we're able to connect and collaborate and just go forward, just continue to do stuff, especially for black people in general. I think it's just important that we have a platform and a way to just talk about these issues, to really push them forward and move them. So thank you so much for coming on the show today. I appreciate you sharing your story and your insights and everything like that.
Absolutely. Thank you again, Omari, for having me on your podcast. I really enjoyed our conversation, and until next time.
Yeah, me too. I really enjoyed it. And just some housekeeping items for everyone. Thank you all for watching or listening, or wherever you're listening or watching this. Make sure that you subscribe, like, review, and share with a friend. I greatly appreciate you all. Public Health Millennial out.